Hi, I'm Jacqueline. I'm going to be doing a catheterization on my patient today. First, I'm going to verify orders from the doctor on the patient chart. Then I'll enter the room and close the curtain and the bed to ensure patient's privacy. Then I'll be confirming my patient's identity with asking birthday and full name and comparing that to the wristband and the chart. I'm going to perform hand hygiene first. Then I'm going to put on some clean gloves. I'm going to instruct the patient what we're doing today and why the doctor put in the order, and that we're going to be cleaning her perineal area. And I'm also going to help her get into a supine position with her knees facing outwards and her legs open. I'm going to be using non-rinse soap and water to clean. I'm going to start on the left side and go in a downward motion. Then I'll be folding the towel so the same part isn't touching the patient again. And I'll be doing the right side and then folding one more time and cleaning right down the middle from the meatus downwards. I'm going to get rid of my towel, my washcloth, and I'm going to discard my gloves. This is where I perform hand hygiene. I usually use soap and water since this is a sterile process. I'm going to be super careful to be opening my sterile kit by using the corners and not touching the inside. And I'm also going to be opening it outwards away from me. I'm going to grab my sterile gloves and I'm going to put them aside from the sterile kit. That way it just reduces the risk of contamination. I need to use this one, pinch the outside and slide them on. Now this is sterile, I can pinch right here to slide it on. And I'm going to discard by pinching the middle and throwing that away. So now I'm going to be draping my patient. I'm going to put the shiny side down. I'd have her lift up her butt and just tuck that underneath her. Then I'm going to use this drape to put over, making sure to only touch the outside corners and just placing that over the area we'll be working with. Now, since I have sterile gloves, I can get all my supplies ready since I'll only be able to use one hand once I start the process. I'm gonna get my Q-tips, my cleaning Q-tips out. I'm gonna get my lube ready and put it in the tray. Take the cap off my syringe. I'm gonna be placing this tray between the patient's legs, and now I'm gonna get my catheter out. It's extremely important to keep this sterile. So I want to make sure that I have a really good firm hold on this while I'm taking the sheath off. And I'm going to be placing it in the lube. And I want to make sure everything stays within my 1-inch margins on the edge. And I'm going to be connecting my syringe up, that way I can easily access it. So now I'm going to tell the patient what I'm doing. I'm going to be opening the labia with my non-dominant hand, and I'm going to be cleaning the area. I'm going to start on the left side and go down with one swipe, and then I'm going to discard. I'll grab one more and do the right side in one sweep downward and discard. And then I'm going to be doing the middle and wiping downward. I'm going to then explain the patient that I'm going to be inserting the catheter now, and there could be a little bit of a burning sensation, and to let me know if she's feeling any pain. I'm also going to instruct that she takes a big breath in and out, and on the exhale is when I'll be putting the catheter in. So I'm going to want to kind of loop this up, and I'm going to place it and being careful not to touch the patient as I'm putting it in there. You're going to go 2 to 3 centimeters in. And with this hand, you're going to kind of pinch the tube just so it stays where it needs to be. And once you see a flash of urine is when you can advance it 2 centimeters more, and then you'll hold it in place and use the saline to fill the balloon in the catheter. So after that, I can let go of the patient. I want to gently pull on this just to make sure that it's in there and it's not going to come out, and you stop when you feel resistance. Now I can take off my syringe. I'm going to discard everything that I don't need now. I'm going to get my bag over here. And I'm going to use this drape to clean the patient. And discard that. Now I'm going to hang the bag to the side of the bed, and it needs to be below her bladder. And I'm also going to connect this tubing with the lock against her leg. That way it doesn't get pulled out, but gives her a little bit of slack to move around still. After that, I will take my gloves off. I will perform hand hygiene, and then I will document my procedure. I want to make sure that my patient is covered again and comfortable and doesn't need anything else. And that's it. Thank you.